My name is Sarah Amo Mensah, and this is a presentation of my Doctor of Nursing Practice project titled Reducing No-Show Rates Through Multiple Text Message Reminders, a Quality Improvement Project in Behavioral Health. The community members are Dr. Holly Justak of Maryville University School of Nursing and College of Health Professions. The second reader is Dr. Boniface Stegman, also of Maryville University College of Health Professions, and the community person is Dr. Isaac Buffer. Background and significance. So the aim of the project is to evaluate the effectiveness of multiple SMS appointment reminders in reducing patient no-show rates in an outpatient behavioral health clinic. For the background information, patient no-shows occurs when patients do not show up for their scheduled appointment without prior notification to the clinic. Patient no-shows have become a persistent challenge in the behavioral health settings, especially the outpatient settings, and rates have been reported to be as high as 50%. When patients miss their appointments, it impacts both the patient and the clinic negatively. Missed appointment can disrupt care and worsen the patient's symptoms, as well as reduce the clinic's productivity. Multiple patient level and system factors contribute to high no-show rates in the behavioral health setting. Patient level factors identified um, are low motivation, anxiety, or cognitive impairment. Some system factors identified have been stigma, cultural beliefs, or even issues with transportation. However, a major cause of patient no-shows have been found to be forgetfulness. Project was conducted in an outpatient behavioral health clinic located in the northeastern United States. It serves about 500 established patients with varying socioeconomic backgrounds in that geographical area. Also, it operates as a private clinic and provides psychiatric evaluation, medication management, psychotherapy services, and also provides both in-person and telehealth services. The patient population is mostly adult population, ages 18 to 65, and mostly treats major chronic psychiatric disorders such as anxiety, depression, psychosis, personality disorders, or neurodevelopmental disorders. The clinic had the problem of high no-show rate as high as 29% per intervention. Studies have shown that reducing no-show rates improves continuity of behavioral health care through better symptom management, reduced hospitalization, and improved treatment adherence. Studies have also shown that reminder systems such as text messaging improves appointment adherence. SMS reminders are low-cost, scalable intervention to improve appointment adherence. This project therefore supports quality improvement initiatives and value-based care. Review of literature. A study by Ant et al. 2020 reveals that patient no-shows negatively affect clinical outcomes and healthcare efficiency. Another study by Marble et al. 2020 shows that common barriers to appointment Attendance include forgetfulness, transportation issues, and mental health symptoms. Guru Ugansi et al. 2013 also showed that text message reminders improve appointment adherence across all health settings. Uola Perez 2022 also revealed that multiple SMS appointments are more effective than a single reminder in reducing missed appointments. Contar et al. 2022 showed that through their studies that reminder systems act as a behavioral health cues that prompt patients to attend scheduled visit. And a study by DeCroft et al. 2023 also shows that improved attendance to appointments leads to better treatment continuity, reduced hospitalization, and improved mental health outcomes. Theoretical framework. This project was guided by the health belief model. So, the health belief model is a psychological framework used to explain why an individual may or may not engage in a health related behavior. And the health belief model explains behavior based on perceived susceptibility, perceived severity, perceived benefit, perceived barriers, cues to action, and self efficacy. And this framework informed the project by targeting behavioral factors such as forgetfulness that affect adherence to appointment, um, and the SMS reminders also acted as a cue to action by prompting appointment attendance. Project was a quality improvement project which utilized a quantitative quasi-experimental pre and post design. The project consisted of two phases, that's the pre-intervention and the post-intervention phase. The period for the pre-intervention was 12 weeks and the post-intervention was 8 weeks. During the pre-intervention phase, the clinic had its standardized reminder protocol that consisted of one email reminder 1 week prior to the appointment and an SMS text message reminder 72 hours the appointment. During the post-intervention phase, the reinforced SMS reminder system was implemented, which included two reminders sent at different intervals. That is the 72 hours prior to the appointment and also 24 hours prior the appointment, and it ensured consistent and automated reminder delivery. Reminder content and timing were standardized, and the attendance were compared before and after the implementation. Data was mostly obtained from the electronic health records. Data collection included a retrospective and prospective review of the identified EHR data. A structured Microsoft Excel sheet was used to collect the data. Variables collected included patient demographics, appointment type, appointment reminders, appointment reminder delivery status, and appointment attendance outcomes. Reasons for the design. So the design were chosen um, because they were appropriate for evaluating practice change interventions, and it also allowed comparison of outcomes before and after implementation, and this supports the evaluation of interventions in a real world clinical setting. Sample. Sample characteristics included A total of 126 appointments were reviewed, and that is pre-intervention 63 appointments and post-intervention 63 appointments. For the population, they were adult outpatient behavioral health patients within the age range of 18 to 65 years. Inclusion criteria were that the patient should be established at a clinic, patient should be diagnosed with a mental health disorder, the patient should have access to a mobile phone, and the patient should have a history of missed appointments. Data analysis. The statistical test used is a z-test for difference of two proportion. And the reason for selecting that test is because it compares two independent proportions and is also able to determine whether no-show rates differ significantly between groups. So the variables here are the independent variable, which is the multiple SMS reminder, and the dependent variable is the no-show rate. For pre-intervention, the no-show rates for the pre-intervention period was 18 out of 63 appointments, representing 28%. And the post-intervention no-shows were 7 out of 63 appointments, representing 11.1%. And this shows an absolute reduction of 17.5 percentage points and a relative reduction of 61%. A one-tailed two-proportion z-test was conducted, and the z-test statistics showed a minus 2.4572 with a p-value of 0.0070, thus showing a 95% confidence interval for post and pre, and effect size of a 0.17403 and achieved power of 0.80. The reduction was statistically significant at the alpha level of 0.05. Results. This is a visual presentation of the results using a pie chart. So for the pre-intervention, the blue session is for no-shows, and the orange session is for showing up to appointments. So you can see the pre-intervention no-shows at 29%, and the show-ups was 71%. And the post-intervention no-shows in the pie chart shows the blue section, that is the 11%, and the orange portion is the 89% of show-ups. And this shows the reduction in no-show rates post-intervention. So the interpretation here is that the SMS reminder significantly improved appointment adherence. Limitations. This study was conducted in a single site, that is one behavioral health clinic, which may limit generalizability to other healthcare settings and also different patient populations. The other limitation was the sample size. A total of 126 appointments were reviewed, which is smaller than the recommended 154 appointments by the Maryville University statistician, and this was a result of the clinic's relocation and therefore reducing their caseload. The other limitation was the short follow-up within the period of where the project was carried out. Proposed intervention could only be done within 8 weeks, and that has the potential to limit long-term sustainability of the SMS reminder intervention. Also, patient engagement were not measured, so the EHR system was able to confirm whether the appointments with the SMS reminders were delivered. However, the system was not able to determine whether the patient read the messages or they reacted to the messages. Another limitation is also about limited patient data. So there was a limited demographic information or psychosocial variables collected, and therefore this could not help with um, the ability to analyze factors influencing the no-show behavior. The other limitation was the design limitation. So pre-post design reliance on cell phone access may introduce confounding factors in participation. Discussion. The findings from this project shows that multiple SMS reminders reduce no-show rates and improve patient engagement. So multiple SMS reminders directly addresses the problem of missed appointments that affect patient care and clinic productivity. And also the results confirm that patient forgetfulness can be effectively targeted with multiple reminder systems. Therefore, the findings are consistent with existing literature on appointment reminders. SMS reminders act as cues to action, supporting the health belief model. And simple digital interventions such as SMS text reminders can improve patient engagement and improve continuity of care. Implications for practice. Improved appointment adherence enhances continuity of mental health care and patient outcomes. Increased attendance supports treatment adherence and may reduce relapse risks. Reducing no-show improves clinic efficiency, productivity, and resource utilization. The improved revenue estimated by the clinic during this post-intervention period was estimated to be about $2,000 for the sample participants within the 8 weeks period. Therefore, SMS reminders, they are low-cost, scalable interventions that can be easily integrated into any existing EHR system. And these SMS reminders could be used effectively for addressing the problem of no-shows. In conclusion, this Doctor of Nursing Practice Quality Improvement Initiative evaluated reinforced SMS appointment reminders to reduce patient no-show rates. SMS reminders are an effective intervention for reducing no-show rates. It helped improve clinic workflow and enhance patient engagement. The project demonstrated statistically and clinically meaningful improvement in appointment adherence. This work highlights the impact of simple technology-based interventions in improving healthcare delivery. Future work should include larger sample sizes, um, longer follow-ups, and more patient-level data. The DMP program has strengthened my ability to apply evidence-based practice, analyze data, and implement practical solutions, and system level thinking. Francis. The references are below. These are the references. Thank you.